The School of Nursing actually decided to get going with their simulation program back in 2008, and the goal was to integrate simulation into the entire undergraduate program. For our students, when they get ready to come to the simulation center to participate in a simulation, we actually have them do some learning ahead of time in order to make sure that our simulation is very effective. We have a course tools site set up for them, basically an online repository where they can go and access what we call our pre-learning information. And so students, if they're coming to the simulation center to participate in a simulation around heart failure, then we're going to ask them to go into the course tools site and complete the pre-learnings. Oftentimes those might be an article around current evidence-based practices for caring for patients with heart failure. It might be a list of skills that they need to practice in order to be able to perform them correctly in the simulation. It might be some communication techniques that they might be going to use in the simulation. So once they arrive at the simulation center, then they participate in a pre-learning quiz. That way we can assess student learning at that time. We can make sure that they read the materials, they understood the materials, and then we'll discuss any questions that they have regarding the pre-quiz before we actually start them into simulation. It's kind of our sort of our checkpoint to keep our students accountable for their pre-learnings. We select maybe 2 or 3 students to actually participate in the simulation, and the rest of the students then participate as observers, and they watch the simulation through a live video stream. So students are going to be in the simulation will get a report similar to what they might do at the beginning of their shift. Sometimes that will be a written report, sometimes we'll give them a verbal report at the beginning. And it's basically information about the patient, what their background is, what their current labs are, what their current vital signs are, before they go into the simulation, so that they have that background information. We don't give them a lot of information about what to expect in the simulation, because that's part of the learning, is that simulation unfolding and the students be able to experience that just as they would if they were in the clinical site. The other part of the directions we give the students is what role they're playing.
So we're going to start, that mom pushed her call late, she's concerned, and you guys are coming into, so you can be on your unit 12 West.
He's in respiratory distress. Is he just having trouble breathing, or is he coughing when we come in the room?
You'll see.
Then we're also really looking for an opportunity to explore with the students, how do I respond in a situation when the patient condition is changing? Or how do I respond in a situation where I need to do some patient education or some discharge teaching, or perhaps help a family member who is struggling with a difficult diagnosis for their family member.
How's your chest pain?
Oh, it really hurts. It feels like I have an elephant sitting on my chest.
Characteristics for the most effective simulations really require things to happen relatively quickly and sometimes in a big way. Our simulations are relatively short, and we really want to get some action going and get the students thinking. And that's how they develop their critical thinking skills and their judgment skills, is to be able to respond quickly in those changing environments.
Can you hear the phone ringing?
Not right now.
It's ringing and nobody's there when I answer it. What are you whispering about?
Oh,
don't take my stuff.
No.
Don't take my money. Help me, help me, help me, help me.
During the debrief, the observers use a structured form to take notes, and part of why we did that is because we want the students to really focus on some of the key learnings in that simulation. And we found prior to using that, sometimes they were paying attention, sometimes they were focusing on the right things, sometimes they weren't necessarily focusing on the things that we wanted them to do.
From your perspective, we'll start with you guys first, since you were the nurses. What are some things that you felt like you did well, and what are some things that you think now at the end, yeah, maybe we should have done this instead?
I feel like using mom as a resource was really well, because I mean no one knows their child better.
You got it. Better than mom. Good. Or dad or whoever. Yeah, good.
I think we got a lot of like good history, not like way back history, but like present history.
Current
situation.
Issue.
Yeah, history.
Yeah.
We didn't go into like anything from before, like if this has ever happened before, or
yeah, which maybe we should have done.
Yeah, like if she had any. I mean, this says she was healthy at birth, but I mean it's been 6 months since she was born, so there are other things that could have happened since.
Okay, so the rest of you who were watching, same question to you. Some things that you thought they did a nice job with, and some things that you thought maybe you would have done a little bit differently.
They did really good asking all the questions. They got a good baseline about
Yes, they did.
everything.
Yeah.
And just making sure that, because they kept saying, you know, we read about it, but we want to hear it from you. Just like making sure that you have a clear cut understanding kind of what's going on.
Good, good.
If they don't do well, but they walk out of there saying, I understand what I didn't do well with, and these are the things that I'm going to work on to make sure that I do better the next time, then that's where it ends. That's what we hope for.